Hello, my name is Dunia Gibson. I'm the family nurse practitioner student. I'm going to be collecting your health history today. Your name is?
Velma.
Velma, can you give me a date of birth?
April 26, 1976.
Okay, can I call you Velma?
Yeah, sure.
Okay, and you can call me Dunia as well. Okay, Velma, is there any hearing impairment or visual impairment that could hinder the interview? Okay, do you want to use the bathroom before we begin?
No.
Are you comfortable?
Yeah.
Okay, what brings you in today?
Just been having a lot of pain in my right here on my side. Just like some strong pains in my side.
Okay. How long have you had the pain?
For about 3 days now.
Okay. Can you give me the exact location?
Yeah, right here. Right here.
Okay.
Yeah.
All right. What was the when the pain comes? How long does it last?
For a couple of seconds. Yeah. About a couple of seconds.
And you say you've been having the pain for how long?
About 3 days.
3 days. Okay. What is the character of that pain? Meaning, is it sharp pain, dull pain?
There's like a sharp pain. It's just like right here. But like I said, it doesn't last too long. For
Okay.
A couple of seconds, yeah.
Are you doing anything when the pain starts?
No, it's sometimes it just there's nothing specific that I'm doing or
Okay.
specific time. It will just happen.
Okay. Does anything relieve the pain?
I take Motrin. That seems to help.
Okay.
Yeah, it helps.
Okay. On a scale of 1 to 10, 10 being the most pain and 1 being the least pain, what would you rate this pain?
When I had them, it's about an
8. Okay. Okay. All right, Velma. Now I'm gonna ask you about your past medical history. Okay. Have you had any illnesses in the past?
8. No.
Okay. Any surgeries?
Yeah, I had a surgery to remove a polyp from my uterus.
Okay. When was this?
This was 2014. November
Okay.
2014.
Okay. And how did that work out?
That went well.
Okay.
Yeah, went pretty well.
Okay. Any hospitalizations? Okay. Velma, do you take any maintenance medication?
Except the Motrin that I told you about.
Okay. So the Motrin is the only over-the-counter medication you take? Any vitamins or supplements like that? Are you allergic to any medication?
When I lived in Liberia, I was allergic to chloroquine, but I haven't taken it since here.
Oh, okay, right. Okay. Velma, do you have you ever been exposed to tuberculosis?
No.
Okay. Have you ever had any blood transfusions in the past?
No.
Okay. All right, Velma, are you married?
Yes, I am.
Do you have children?
I have 2 children.
Okay. What do you do for a living?
I'm a nurse.
Okay. All right. When was your last annual physical?
Last year, I took a physical for work, so that was...
Okay. And what about dental?
Same, I'm up to date, but I will actually be going for my checkup the beginning of July.
Okay. So you turned 40 this year. You were born 1976?
Yeah.
Okay. When was your last, so you're planning to have the mammogram done this year?
Well, it's not scheduled, but yes, hopefully when I speak to the doctor, they'll let me know more information about that.
Okay, please do. Okay, Velma, do you do self breast exams?
I did in the past, but not anymore.
Okay. All right, Velma, I'm going to ask you about, do you drink alcohol?
No.
Okay, any illicit drug use? Okay, no illicit drug use. That's good. Do you smoke cigarettes? Okay. All right, Velma, tell me about your diet on a 24-hour basis. Just give me what you eat.
Pretty much in the morning I would have a bowl of cereal, coffee, or sometimes eggs or so. And lunchtime, I would say a sandwich or salad or something like that. And for dinner, I usually have like some kind of greens with steak or chicken and some rice or pasta.
Okay. Do you drink a lot of water?
I drink a lot of water.
Okay. Velma, do you exercise?
I don't like go to the gym, but I do take time, maybe about a couple of times during the day. I walk more than not saying in a real person, but I do a lot of walking.
You do a lot of walking. That's good. What would you consider yourself? Do you consider yourself a healthy person? Do you get, meaning, let me give you, meaning, do you get tired a lot?
Yeah, I do get tired a lot, but I'm not, Maybe I don't know if it's because I wake up too early and I go to sleep. I mean, and then so by the time 8 o'clock is here, I'm exhausted. But I do wake up at 6 o'clock every day, 6
Okay.
a.m. So maybe that's why I'm tired. So,
Okay.
but
Any night sweats, fevers?
no.
Okay. Now we're gonna go into your family history. I'm
Okay.
gonna ask you about your family health history. Okay. Your mother, your grandmother, your children.
Okay.
Okay. Do you have any cancers in your family?
No, not that I know.
No cancers. Okay. What about diabetes?
Actually,
Go ahead.
my mother and my grandmother both have diabetes. I know my father has said in the past that some of his family had diabetes, but
Okay.
I'm not too certain which ones.
Okay, so your mother and your grandmother, right? Do you know what age they were when they got diagnosed with diabetes? And what kind of diabetes?
Yeah, my grandmother and both my grandmother and my mom have type 2 diabetes.
Okay.
And my grandma was probably in her 60s when she told us she got diagnosed, and my mom was about 40s when she got diagnosed.
Okay. And are they being maintained on insulin?
My grandmother used to take insulin, but I think the doctor, about 2 years ago, the doctor stopped that, so she's just on regular pills.
Okay.
But my mom also, she's on regular pills but no insulin.
Okay. And is their diabetes controlled?
Both the diabetes are controlled.
Okay. What about stroke?
No history of stroke in my family.
Any heart disease?
No.
Hypertension?
Both my parents have hypertension. My grandmother also has hypertension.
Okay, can you tell me more about it, about their age of onset? For your grandmother, let's start with her.
I'm not sure of any one of them. Again, my grandmother got diagnosed with hypertension the same time as her diabetes.
Okay.
Yeah, so, but she
So
may have
around
had it-
60s.
Yeah, she may have had it all her life and didn't know.
You
about
didn't
it.
know,
Yes.
right.
My mom, I think probably when she maybe in her 30s or 40s.
Okay.
My dad, around the same age, probably 40s.
40s.
Yeah. Or
Okay.
maybe 50s with my dad.
Mhm.
Yeah.
All right, Doma, do you know if there's any sickle cell anemia in your family? Anybody carry the traits?
No. Neither, no. I know my husband actually has said that they carried a trait,
Okay.
and we were concerned about our kids, but none of them have. We haven't seen any
Okay.
of that
Okay.
in my children.
In your children, right? Were they tested to see if
Yeah.
they carry the traits?
Right, both kids. Yeah.
They're fine.
Yeah.
Okay, that's good. Okay, now Doma, we're gonna talk about the head to toe assessment.
Okay.
I'm just gonna ask you a few questions. Okay? Are you comfortable?
Yeah, yeah.
Okay, great. Have you noticed any rashes on your skin?
No.
Any change in pigmentation? Okay, all right. Any headaches? Do you get headaches?
The occasional headache I get, but nothing like a migraine or, constant headaches.
Okay.
Yeah, nothing,
All right.
nothing
Any
consistent.
loss of consciousness?
No.
Okay.
No. I mean, even I have been in an accident, but I never lost consciousness
Any head
in a car
trauma?
accident. No, I didn't hit my head.
Okay. All right. Velma, do you wear glasses?
No, I don't.
Okay. Do you have any problem with eye, meaning double vision, blurry vision?
Well, I'm not gonna say blurry, but a lot of times, recently I've been experiencing a little fogginess, well, little clouds
Oh
when
yeah.
I blink, and then when I close my eyes, so I would have to maybe rub it or try to refocus. But I see, it's like a little bit cloudy.
Okay.
Yeah, but
And how often does that happen?
like yesterday, I was the day before yesterday I experienced it, but not today or yesterday, but maybe like couple of minutes.
Okay.
And
And
then
when
I'll just try to
when did it
refocus.
start?
I think like 2 days ago,
Okay.
I started noticing that when I,
Are you sitting in the dark when this happens, or it just happens just spontaneously, or?
no, not when I'm sitting in the dark.
Okay.
Yeah. I don't remember exactly what I was doing when I started, but I remember just trying to rub my eye I didn't just wake up.
Okay.
So I was just trying to just like focus or, try to like stretch my eyes open.
Right.
Yeah.
Okay, Velma, do you have any hearing loss?
No.
Any ringing in your ear or discharge?
No.
Okay. Any problem with the sense of smell?
No. Actually, I have a really good sense of smell. so-
Okay. All right. Any congestion?
No.
All right. What about nosebleed?
No, I don't. My son gets a lot of nosebleeds, but I don't.
You don't.
Yeah.
Okay. All right, Velma. Any problem with dental?
No, no. I mean, I have cavities,
Mm-hmm.
and I had all four of my wisdom teeth taken out.
Okay.
I need three, but and I have cavities, like I said, up here, down here, but no actual problems with.
Okay. Any bleeding gums or also sores in your mouth?
No,
All right. Do you have difficulty swallowing?
no,
Okay, Velma. When you swallow, when you eat and swallow, do you suffer from heartburn,
no.
indigestion?
No.
Tell me about your bowels, please.
Pretty regular. I go every other day, and it's not like I'm constipated or anything. It's just
Okay.
like a real easy going.
All right, that's good. All right, Velma. Do you have any lumps and tenderness in your neck, in your armpits? Okay. All right. Do you have excessive urination or excessive thirst?
Only when I was pregnant, but not now.
Not
just
now.
regular. I think I go to the bathroom at nighttime more than the average person, but I drink a lot of water.
You
so
drink a
I-
lot of
yeah.
water.
But no, I don't have like excessive thirst or anything like that. I just like to drink water.
Okay. Any excessive weight gain or loss?
No, I've been pretty much it with my pregnancy. Yeah, I'll gain a couple of months, but pretty much been consistent with my weight.
Okay. What about shoe size? Have you noticed any change in shoe size lately? Not when you were pregnant, but of lately?
Yeah, well, before I was at 8.5, now I'm a 9.
Okay.
So I don't know when that change took place, but
All right, Velma. Can you tell me when was your last menstrual cycle?
about 2 weeks ago.
Okay.
Yeah, 2 weeks ago.
All right. When was your age when you started having your period?
At age 15.
At 15. Okay. And you told me you had children. How many children do you
I
have?
have 2.
Were they full pregnancies?
Yeah, full time.
Okay. And you're married?
Yes.
Okay, Velma. Any sexual transmitted diseases in the past or right now?
No.
Okay. Do you practice? I'm sorry. Are you on contraception?
Yes, I am.
Okay.
I took the Depo-Provera shot.
Okay. And how does that working for you?
It's okay. I just took it recently, so I haven't seen any kind of change
Okay.
or felt any change. But I have taken it in the past, and I noticed that I lost a tremendous amount of weight, and like my hair was thinning out. So I stopped. But this was about maybe 15 years ago.
Okay.
But I took it again because I don't like the IUD
Okay.
or the birth control pill. So
All right.
I'll try.
You'll try it again.
Well,
You're trying it again.
We're trying it again to see if it, if it gets, if I get the same results, I'll stop. But for
Okay.
now, I haven't.
You're okay with it
experienced
now.
anything yet.
That's good. Okay, Velma, any lumps or tenderness or discharge coming out of your breast?
No,
Okay. Any shortness of breath?
no.
Any labored breathing? Okay. All right. You're doing fine. Okay. Any chest pain? Have you experienced any chest pain?
No chest pains.
What about palpitation? Okay. All right. Anything like swollenness in your arms, in your feet?
No,
I'm sorry, in your hands, in your feet, no swollenness?
No, nothing.
Okay. All right, Velma, do you have any flank pain?
when you say flank.
Flank pain, like pain in the back here, like kidney pain?
Sometimes I will get pains like that, but that's probably I know that's when I don't drink a lot of water.
Okay.
Yeah, and like if I just like if I'm a couple of days I drink like sodas and stuff like that because sometimes I can't. I love to drink water, but sometimes I just can't because my mouth is bitter. I'll drink sodas and I'll notice that, but that's like very seldom.
Okay. Any burning urination?
No.
Okay. Any blood in your urine?
No.
Okay, Velma. Thank you. Do you have any swollenness in your joints?
No, I don't get swollen.
Okay. All right. Any muscle pain, muscle aches?
No.
Okay, Velma. Do you bruise easily?
No, I don't. I'm clumsy. I'm always hitting my legs or my hands, but I don't bruise easily.
So no anemia.
No.
Okay. Okay. Any loss of coordination?
No. Pretty much. I'm okay with that.
Okay. Have you had any change in your sleeping habit of lately?
Not change. No. It's not change. I'm just
Okay.
regular 6-7 hour sleeper.
Okay.
Yeah, but nothing like inconsistent sleeping. When I sleep, I sleep.
Any anxiety disorders? Okay. Any depression? No depression. Okay.
I mean, yeah.
Mhm. Okay. Any suicidal or homicidal ideation?
No, no.
Okay.
I have kids. I can't do that.
Right.
No.
Okay. Well, Foma, thank you very much. I do appreciate your time
Okay.
doing the interview.
All
Thank
right.
you.
Thank you. Nice to meet you.
Same here.